Hi there. Welcome back to Mastering Medicare, the series where we cut through all the confusion and red tape and give you the facts you need to make the smart decisions about your own healthcare coverage. I'm Dr. Lance Koss, and if you've been with us for the first two episodes, you know that I'm here to help you avoid the biggest mistakes I see people make with Medicare, which is a great way to segue into today's topic since it's one of the worst mistakes of them all. Why? Because it's one that could cost you thousands of dollars in penalties and higher premiums. And trust me, I know this firsthand because someone in my very own family made this exact mistake and they're now paying the price literally. So here's what happens far too often. People think that they can just enroll in Medicare whenever they want with no consequences. They assume because they're still working at age 65 or because they're in good health and they don't need it yet, why should I enroll? Who needs to sign up right away? And while that may be true in some cases, in many others, delaying Medicare can cost you for the rest of your life. That's right, Medicare isn't always forgiving, and if you missed your enrollment window when you should have signed up, you will pay extra every single month for the rest of your life. I've seen firsthand just how devastating that can be. Let me tell you about someone in my very own family who made this exact mistake. He's a veteran and was receiving his health care through the Veteran Affairs system. Since the VA covered most of his medical needs, he assumed he didn't need to enroll in Medicare when he turned 65. After all, why sign up for something when you already have coverage, right? Makes sense. But here's what he didn't realize. VA coverage is not considered credible coverage for Medicare Part B. That means he had no idea that the clock was already ticking on his Medicare enrollment, and he went on for years thinking he was fine and could just enroll whenever he finally needed it. Well, fast forward to this year when he wanted to enroll in Medicare Part B, and that's when things got ugly. Because he had missed his initial enrollment window, Medicare hit him with a lifetime penalty. That's right, for every year he didn't sign up, his Part B premium went up by 10%. And he's now paying over $400 more per month for the rest of his life. And let me tell you, that is not the kind of retirement surprise anybody wants. Imagine being on a fixed income and suddenly having to pay hundreds more every month just because of some simple mistake that could have been easily avoided. And the worst part, there's no way to undo it. No appeal, no waiver, just an expensive lesson learned the hard way. So how do you make sure this doesn't happen to you? First, let's go over when you absolutely need to enroll in Medicare to avoid penalties. Number one, Part A or hospital coverage. For most people, there's no penalty for not enrolling in Medicare Part A at age 65 because it's premium free if you or your spouse have worked and paid Medicare taxes for at least 10 years. However, if you don't qualify for premium free Part A and choose not to enroll when you're first eligible, you could face a late enrollment penalty if you decide to sign up later. As a heads up, if you're already receiving Social Security benefits at age 65, you should be automatically enrolled in Medicare Part A. But big tip, you should always still double check your coverage and make sure. Number two, Part B or medical coverage. If you're retired, unemployed, or your employer has fewer than 20 employees, you must enroll in Medicare Part B at age 65 or you'll face the lifetime enrollment penalty. At that point, Medicare becomes your primary insurance and any employer coverage you have will no longer pay for what Medicare should have covered. Number three, Part D or prescription coverage. If you don't have credible prescription drug coverage through your employer or someone else, you must enroll in Medicare Part D when you're first eligible, or you'll face a permanent late enrollment penalty. Okay, who doesn't have to enroll at age 65? Number one, if you're still working and your employer has 20 or more employees, you can't delay enrolling in Medicare Part B without a penalty. Your employer's health plan will continue as your primary insurance, and you won't be forced into Medicare just yet. But be careful, this only applies if your employer plan is considered credible coverage under Medicare rules. If you're unsure, ask your HR department, and my big professional tip of the day, always get it in writing from them that you have credible coverage. If you have employer-sponsored insurance through a company with more than 20 employees, you can delay enrolling in Medicare Part B. 3. If you have credible prescription drug coverage, you can delay enrolling in Medicare Part D. Okay, here's the special one. If you're contributing to a health savings account, often called an HSA, you may want to delay your Medicare enrollment because you'll need to stop all contributions once you enroll. And if you remember from an earlier episode, you should stop all your HSA contributions at least 6 months prior to when you enroll. Now let's talk some numbers because these penalties can add up fast. Just ask one of the more than 3 million Americans who are currently paying a penalty for their Part B or their Part B coverage. Yep, you heard me correctly. This is a lifetime mistake that is being made regularly, and it's such an easy one to avoid if you simply pay attention to the rules. So what is the Part B late enrollment penalty? If you miss your Medicare Part B enrollment, your monthly premium increases by 10% for every 12-month period you were eligible but did not sign up. And don't forget the catch, this penalty is permanent, so once it's added to your premium, you'll pay it every month for the rest of your life. So what does that look like in real life? Let's say you turned 65 in 2020 and you didn't enroll in Medicare Part B because you mistakenly believed you didn't have to. You continue without coverage for 5 years before realizing your mistake, and you try enrolling now at age 70. So here's how that penalty would be calculated. You didn't delay enrollment for 5 full years or 60 months. The Part B penalty is 10% for every year of delay. So 10% times 5 equals 50% penalty that will be added to your monthly Part B premium. So if the standard Part B premium in 2025 is $174.70 a month, your new monthly premium would be $262.05 per month. That's an extra $87.35 every month, which adds up to more than $1,000 per year for the rest of your life. Now imagine you live for another 20 years. That's an additional $20,000 you'll end up paying in penalties just because you missed your enrollment window. And this is why it's so critical to enroll in Medicare Part B on time unless you have a valid reason to delay, such as an employee-sponsored coverage from a company with 20 or more employees. Okay, now how about that Part D late enrollment penalty? If you go 63 days or more without credible prescription drug coverage, you'll pay an extra 1% per month you were without coverage for the rest of your life. All right, so let's wrap this up with what you can do to avoid these costly mistakes. First, mark your calendar for your Medicare initial enrollment period, sometimes called the IEP. It starts 3 months before your 65th birthday and will last 7 months after your birthday. Next, talk to your employer's Human Resources Department. Ask them if your plan is considered credible coverage for both Medicare Part B and Part D, and above all, get it in writing. Next, set a reminder for Medicare Special Enrollment Periods, sometimes called SEPs. If you delay Medicare because you're still working, you have 8 months after you retire or lose coverage to sign up. So if you take just one thing away from today's episode, let it be this. Medicare enrollment is not automatic for everyone, and if you don't enroll when you should, you'll be paying for that mistake for the rest of your life. Whether it's Medicare Part B or Medicare Part D or both, delaying when you shouldn't can mean permanent penalties that never go away. And like I said earlier, I've seen firsthand just how devastating that can be. The good news, now that you know the rules, you don't have to make the same mistake. Be proactive. Mark your calendar. Talk to your employer if you're still working. Double check if your drug coverage is considered credible. Do whatever you need to do to make sure you're enrolling at the right time and avoid those penalties. Because once those penalties start, they never stop and they could really add up. Next time on Mastering Medicare, we'll be tackling another major mistake people make far too often, choosing the wrong Medicare coverage and getting stuck in a plan that doesn't actually work for you. We're going to break down how to compare those Medicare Advantage and Medigap plans, what you need to watch for, and how to make sure you're not overpaying or losing access to your favorite doctors. You won't want to miss it. As always, if you found this episode helpful, please like below and make sure you subscribe below as well so you won't miss any upcoming episodes. And please share this video with anyone you know that absolutely needs to hear it. And if you want a deeper dive into everything we've covered today, or if you're looking for that perfect gift for anyone over the age of 65, look for my upcoming book, Mastering Medicare, 65 Things Everyone Should Know by age 65. Thanks again for watching, and I'll see you next time on Mastering Medicare.